Hello everyone, my name is Erica Ramos and I'll be going over bipolar disorder. For bipolar disorder, it is a biological brain disorder that causes severe and unusual fluctuation in an individual's mood, energy, and ability to function, such as mania and depressive episodes. For suggested research in bipolar disorder, it says that it's caused by many factors such as genetic transmission, can be from an offspring. There's neurotransmitter abnormality, environmental factors such as distressing life events, abuse, mental stress, some traumatic events. There's also for mania and bipolar 1 mania and hypomania. There is the symptoms of it is sudden changes in energy and activities. There's mood changes. There's developmental patterns of psychosis. There's also the time frame of a mania episode it lasts about a week. Hypomania lasts about 1 day to 4 days. There's also the depressive symptoms, which is bipolar 2. It is the age of starts around the age of 8.8 years old. There's similarities between bipolar 1 and bipolar 2. Some of those similarities involve like depressive episodes, major depressive episodes, periods of heightening moods, and then the depressive symptoms last about 2 weeks. They begin showing symptoms of mania, which is very slow and very calm. Individuals would show that, and then this is where they go into a depressive episode. What does bipolar episode look like in the classroom? For mania, some of the mania and depressive symptoms may express themselves in a variety of ways, which escalate to harmful situations in the classroom, which probably physical or aggressions or risk-taking behaviors. For depression, symptoms can be introverted, such as crying, withdrawing from activities, difficulty in engaging. They can have also engaging in danger. For both of these, as mania and depression, they can have engaging in danger activities, behaviors to put themselves in risk, hitting other students, teachers, destroying property, or making inappropriate sexual comments towards other students, towards the teacher. So challenges in the classroom: students cannot complete as much work. So they also have students' difficulty with flexibility. They have special education classes. Typically, this is where they will be at. In a classroom like this, they have major impacts of functioning, and they also have difficulties with social function and with peers or making friends. They have an abrupt mood swing that can occur multiple times around in the day. They have low energy, extreme boredom, and also medications can have an impact as well as make them anxious, make them sleepy. In the classroom, they can be like extreme perfectionists. They want everything to be perfect. Then we have the list of strategies that can be used by counselors. So the list of strategies is for social emotional interventions can be such as group counseling, individual counseling, such as helping them with what triggers the mood swings and how to cope with those kind of mood swings. We have cognitive behavior therapy. I found an acronym called Raymond. I'll talking about it in a little bit. There's occupational therapy, sensory and output. There's a behavioral moods reporting chart. So this is the chart that the students and counselors can use to keep track of how constant these behaviors are occurring, and then the crisis management team, which is what I'll be talking about in a little bit. The rainbow, it's first starts with I found this technique that I came across while doing my research. It's an acronym called Rainbow, which is what organizes a team approachment of treatment. The goal is to develop a family structure and routine communication strategies and coping skills to assist students, affected students, in staying in the middle of the mood spectrum. So going over the R is routine scheduling strategies that can reduce stress. Also, this can be used by parents, teachers, just anybody that's surrounding these students. And then also A is affect and anger management. Use mood charts to provide feedback related to medication effects. That's the charts that I was talking about. And then I can do it, highlights the needs to maintain a positive attitude. Encourages and to develop a positive self-statement. N is for no negative thoughts. Applies CBT, cognitive restructuring, the training and adaptive thinking strategies for improved problem solving. B is be a good friend, coaches the child to establish and maintaining positive peer friendships. It also prompts parents to live a balanced life. Optimal problems for O is emphasizes collaboration, parent dialogues, to avoid immediate consequences for these students whenever they have behavior issues in the classroom, not to be sent out, suspended. They actually have something to rely on. And then W is ways to get support for the child and family members. Involves having children draw a supportive tree of all the names of the people that they can rely on when they feel stress or their stress is escalating. There's instructional support for education accommodation classroom protocols. So these are protocols within just education in the classroom. So proper trainings, definitely proper trainings for teachers to understand the nature and the course of emotional liability. Collaboration with therapists. It's very important that teachers collaborate with the therapist. The teacher must be actively involved in the stress management plans. Teacher is coached with prompt strategies. Teacher involves rehearsals. Teacher is also using the exit to timeout strategies, which is giving the students the break to go outside and calm down, come back in the classroom, and positive behavior support for teachers as well. So this concludes my my presentation. If you guys have any questions, let me know.